You're watching AYIT TV, empowering you.
Good evening, our viewers. I welcome you again to our discussion that we usually have, and for that matter, I want to thank AYIT TV for always inviting me to be part of this program. So today I want to bring to our attention a good discussion that affects all of us in one way or another, area of pregnancy and breastfeeding. How we can best use drugs during those two major seasons in the life of a mother and in the life of every baby. So today we want to talk about drug safety in pregnancy and breastfeeding. And I thank people who have given us feedback to highlight more about drug safety, because we had talked about it some months ago, but they wanted us to talk about drug safety in pregnancy and breastfeeding. And so I hope today we'll be able to shed some light and to help our patients use drugs better during those two seasons. So why pregnancy? Why breastfeeding? Like I started, those are two seasons in the life of every mother that are very critical, because there are two lives involved. There is the life of a mother and the life of a baby. During pregnancy, when he's in the womb, and during breastfeeding, when he is depending on the mother for nutrition, for growth, for every kind of life. So those are two very important seasons. And the use of drugs or treatments during these two seasons are both a challenge to the healthcare providers, to the mothers, and of course the unborn baby, and to the community, because if you handle a mother, a nursing mother or a pregnant mother very well, then it impacts well in the community. So why are we interested in looking at safety of medicines in pregnancy and breastfeeding? To start with, we know that, like I said, it's a critical time. Two lives are involved, and both put the other on a vulnerability. The mother makes the baby vulnerable. If whatever the mother does or suffers from, it affects the baby or another, and the other way around. What affects the baby will definitely affect the mother. And also fathers are there suffering, of course, because when the mother is not at peace, then the husband, even the family is not happy. So that is one. Vulnerability. They are vulnerable lives, both the mother and the baby. Secondly, there are two lives involved, meaning that harm to one affects the other. And we also know that there is a lot of misinformation or lack of information on how to best use drugs, during these two periods. We have seen many times mothers discontinue treatment in fear that it will affect the baby, when actually it is safe and it would have helped the mother. And by discontinuing treatment, the mother gets complications, and then by the time they attend to them, by the time the hospital, the pharmacy attends to that mother, you have to give many more drugs that some could be risky for the baby. So information is very key for us as far as use of drugs in pregnancy and breastfeeding is concerned. We also know that, for example, in breastfeeding, this is one nice, it is the best nutrition. Breast milk is the best nutrition for a baby. So what the mother takes during that time impacts in the milk of the baby and so affects the baby. So we know that whatever drug that we are going to give to the mother, we have to think about the baby, okay? And during breastfeeding, whatever drug you're going to give to the baby, you also must think about the mother, especially if it's breastfeeding. Okay? The other big concern why we are interested in breastfeeding and nursing mothers is that this treatment needs strict evaluation of risks and benefits. We know that all medicine, by the time it's given, of course it's beneficial, it must be beneficial, and the benefits must outweigh the risks. But in this particular case, pregnancy and breastfeeding, because there are vulnerable lives involved, there are 2 lives involved, you have to take extra caution. You have to take extra caution and evaluate the benefit, okay, vis-a-vis the risk involved. The other thing, of course, is that during this period, pregnancy and breastfeeding, mothers tend to use, they are highly exposed to diseases that will need treatment. So use of drugs during this period is high, and not one drug, many drugs. Okay, we know for sure that the statistics clearly show that between 20 to 25% of pregnant mothers use potentially unsafe medicines. Potentially unsafe, meaning that if they get it without a prescription, if they use it in a wrong way, if they take medication, if they make any error during medication, it may potentially be unsafe for the mother and for the baby. So there is a lot of drug use involved during this time, because a pregnant mother, a breastfeeding mother, is exposed to greater risks than if she was not breastfeeding or if she was not pregnant. The other thing, of course, is that safety to the mother may not necessarily mean safety to the child. So even as you evaluate the risk vis-a-vis the benefit of the medicine, we should remember that a drug that is safe to the mother may not necessarily be safe to the child. So if you have to be sure that what you're giving is going to be beneficial both to the mother but should not harm the child. And that is why drug safety is very key during this period. Very, very key. In fact, that is one of the campaigns we always make. So now that we have that background, what are some of the considerations we make? What are some of the considerations we make for pregnant mothers or breastfeeding mothers? One, like we said, by the time you give medication, you should be sure that it is what the mother needs. In other words, be sure of the condition you're treating, be sure that the drug that you're giving is the very, very, very right one. In other words, you have to think again and again that the drug must be safe, it must be the right one, must be for that right condition, okay? And you should be sure that it will not be abused by the mother, because any error can be problematic. That is why in such a period we ask that reach out to your pharmacist, okay? Tell him or her what you're taking, which drugs you're taking. It's very, very, very important, so that he is able to tell you, no, I think when you're pregnant, you may stop this and take a safer one, okay? Because there are many drugs that we normally would give to anyone, but when someone is pregnant, we say no. We would rather use a drug that is equally effective but not as unsafe as this one during pregnancy or during breastfeeding. Okay? So you must determine that the medication is the right one and that it is absolutely necessary. The second is that, especially in pregnancy, we must avoid as much as we can medicines in the first trimester. The first 4 months of pregnancy, we must make sure that we reduce treatment. Okay, the first 3 months, we should reduce treatment or drugs used. Okay, only give when it is extremely unnecessary. Okay, the second is that choose the safest available drug. When you have options, choose the most safe. It may not be as potent, or the efficacy, or it may not be too effective, but there is a balance between it being effective and it is still safe. I'd rather give something that can improve symptoms and help this mother, but it is safe, than one that will treat the malaria, okay, but it is very unsafe for the baby. So that is you must use the safest drug available, okay? And I mean, we know drugs that are safe in pregnancy or safe in breastfeeding, okay? So you ask the pharmacist. Some of the mothers already know, of course, if they are senior mothers, this is their third, their fourth pregnancy, they will definitely know. Then the next is that we should make sure that these drugs, of course, their safety should be well taken care of, so that they are not excreted in milk, or when they are excreted in milk, they don't give bad effects to the babies during breastfeeding. Okay, they should be able to have at least a short half-life. When they are given to the mother, they take a short life and get out, so that they do not keep in the system to affect the baby. They should also be dealt with so easily in the body by the mother, so that if there are any toxins, if there are any side effects, they are not there for a very long time. The other thing, of course, is that we would want to go with what we call single agents as much as possible, not combinations. Combinations have interactions that we may not be comfortable with during pregnancy or during breastfeeding. So, for example, if you're treating bacterial infections, and we know that it is good to treat bacterial infections with combination drugs. You combine different classes of drugs to be able to attack the bacteria at different sites, okay, and at different stages of its development. But when it comes to pregnancy and breastfeeding, those combinations may have issues. one of the drugs in that combination may not be safe. So only give when you have no option and you're sure of the safety of that drug. Okay? When you've come to the drug that you can use the lowest possible dose. The lowest effective dose must be definitely be effective, but the lowest, so that the chances for toxicity are reduced. We know that the bigger the doses, if the drug is going to cause a headache, the higher the dose, the greater the headache, okay, and other effects. So we use the lowest possible, the lowest effective dose of that drug. We should also be able to discourage other medications during this period. In other words, when a pregnant mother has malaria and has been given Fansida, the truth is that we don't want her to use any other item, whether herbs, whether even these OTCs, over-the-counter medications, things like Panadol here, ibuprofen here, even vitamin C here. No. Whatever you're going to be taking, we should know. Say that there are no interactions, or it does not, because you're already on treatment for a certain condition. Okay? For malaria will be faster. The moment you now start to bring in, for example, Ciprin for a bacterial cough, you're definitely going to increase the dose of a sulfonamide that is in there, and it can give problems. Okay, so we discourage the use of other things, be it herbals, be it during the treatment when we have given you, when we have prescribed for you drugs during pregnancy or during breastfeeding. And then for breastfeeding, we prefer definitely that we give drugs after we have breastfed the child, okay? Or with time when the child is about to sleep, especially during those times that have long sleeping periods, okay? It could be at night, if the baby sleeps long enough at night, or some during the day. We prefer that you give it, and either you, the mother, you take the drug, and then the baby is able to rest, okay, for a long period, so that it can get out of the system if it comes through breast milk. So that is very key. What are some of the drugs that we find unsafe? Most drugs a number of drugs are very safe during pregnancy, during breastfeeding. Of course, with the right cautions taken. In the right dose, they are given for the right condition, you take them for the right duration, okay? And you keep them in a safe place. All those cautions being adhered to, we still have those drugs that are unsafe during breastfeeding, for example, and during pregnancy. For example, in breastfeeding, oral contraceptives, as much as possible, most of these steroid contraceptives wouldn't allow them when you're breastfeeding. We know, of course, there are times, there are extreme moments where, for example, a mother is likely to conceive even when he's still breastfeeding. It happens. Okay, you must see your gynecologist and he sees which contraception method is best, especially when you're still breastfeeding. So that is very key, and we need to take heed in that. Oral contraceptive steroids should not be in breastfeeding, okay? And many other corticosteroids or steroid treatment during breastfeeding, it's not good because it can prevent the baby from having a normal growth. The other ones are what we call ergots, ergot derivatives. Ergotamine, ergometrin. Ergotamine is used in migraine headaches. Ergometrin is used in to prevent uterine bleeding. When they are given in pregnancy, when, for example, ergometrin is used in pregnancy, it is safe. But during breastfeeding, it may have a problem. Okay, so it's not enough to say that I use this drug during pregnancy. It may be safe in pregnancy, but not safe in breastfeeding. Okay. The other drug that we don't recommend is pyridoxine or vitamin B6, because we know that it suppresses production of milk. Okay, and so the baby will not get enough milk during breastfeeding. But yet, we at times use it during pregnancy, and it is safe. But during breastfeeding, we take caution. Okay, and then drugs of abuse, alcohol, okay, codeine. Most of these drugs that we know pass through the blood-brain barrier, or they can be used to change our mental states. Okay, things like Valium, diazepam. Okay, most of these antidepressants, most of these antipsychotics. When you talk about antidepressants like the clonazepam, lorazepam, that class of drugs, it changes the mental state, and so it is not good to use it during breastfeeding. Only use it when it is extremely necessary. Then there are drugs, of course, that we don't give to children when they are still young, when they are breastfeeding. Okay, like cancer drugs. Okay, cancer drugs being taken by the mothers. It must be taken with a lot of caution. Okay. Then for those that shouldn't be taken by the infants, by the babies, things like chloramphenicol. It's a common antibiotic that we use, but for young children, we make sure that we don't give it. There are better alternatives that we can give. Okay. Otherwise, it causes Rave syndrome, which is really bad to the babies. Okay. Fragile metronidazole, being given to children younger than 6 months, very dangerous, very dangerous. The other drugs of abuse that we talked about, the antidepressants. Some of us who a baby cries and you want to go and bring Valium, okay? Go and bring Valium and give it to a baby for him to sleep. Have you ever wondered why those diazepam has no syrup for children below 6 months, even below 1 year? We don't give it. So, and it's not there. It's not available because it's not good to be given to babies. Okay. And then radiopharmaceuticals. These are the ones we use in cancer treatment. Okay. Keep the baby safe from those radiopharmaceuticals, even if the mother is being treated for cancer. The baby must be protected. Okay. Then, of course, in pregnancy, there are drugs also that are not safe in pregnancy. Most of you have gotten, of course, experience of those ones. You know them because some we fear that are teratogenic, or they are capable of causing harm, okay, to the tissue or to the organs the tissues may not develop very well in the baby while it is in the uterus, while it is in the womb. Okay, all the organs of the baby, of the fetus, baby when it's still young in the womb, may not grow to maturity. So some drugs can cause that. Okay, and really that happens between the 2nd to the 8th week, okay, of pregnancy. Then there are those that can actually cause adverse effects. Okay? So some will prevent involvement of the organs and the tissues of the body of the baby, but others can cause side effects. You've had people that are born with a cleft lip. Now, part of the lip is not there, or it is the twin down, exposing the teeth. Okay, some of those come from using drugs during drugs that are contraindicated during pregnancy. So, and some of course cause stillbirth. Babies die at birth. Okay, so it's very important. Then of course, like I've always said, drugs of abuse. Those are drugs that change the mental state of a patient. Okay, opioids, antidepressants, they are supposed to be contraindicated, except of course in very dire situations where the benefit outweighs the risk. Okay, so a number of such drugs are not used. We should not be used in pregnancy. Our fluoroquinolones or quinolones that ciprofloxacin, levofloxacin, those are not safe drugs during pregnancy. That's why we prefer to give other options. Okay, Primaquine that we usually use for malaria, when it comes to pregnancy, it is not safe. Codeine is not safe. Okay, warfarin that we use for clots is not safe. So it is important that we get to know what drugs can be safe and which ones are. Generally, many of them are safe, but you don't know when you will get one that is unsafe if you just take it for granted. So the best thing is during pregnancy and breastfeeding, whatever medication you're taking, let your healthcare provider know. Let you be knowing how to use it and not to abuse it. And with that, I want to thank you. I want to ask that you continue to observe good, safe medication during pregnancy, safe medication during breastfeeding, such that our mothers are safe, our children are safe, and the entire community is safe. Thank you so much.